75% of people in the United States had access to community fluoride in their water back in 2014. This may seem like a really good number, but it's not good enough, because in comparison to the 329 million people in the United States today, in 2014, that was only 211 million. This is a very big difference. And today I want to share about the pros and cons of fluoride in community water. That is when you turn on your tap or get it from your garden hose, either way. I had the experience of working in Iowa City, Iowa as a dental assistant for 2 years. And there it was mandatory that every single person in the community, wherever you lived in the entire state of Iowa, had water fluoridation. Now this was really great because every child I saw at the clinic had really good positive outcomes if they weren't drinking too much sugar or having too many sugary treats or sticking gummy bears up their teeth or sucking on them all day. When I moved here, I saw a big difference though. I volunteered at Give Kids a Smile, which is a free dental clinic for uninsured and low-income families. And because it's not mandatory in in Utah, and only a certain number of communities in Utah have fluoride in their water, children didn't have as great of an outcome as they did in Iowa. There are pros and there are cons also of fluoride in water for communities, and it's actually also cost effective. So I'm going to share about that. In 2014, the Center for Disease Control studied extensively about children having community fluoride in their water. And they found, after implementing an intervention with the community, that 3 times as many children had three times as many cavities. Children had 3 times as many cavities when they had fluoride when they didn't have fluoride in their water from when they did. And this was a big breakthrough because that study led to the U.S. Department of Health and Human Services in April of 2015 to pass a law saying 0.7 milligrams per liter of fluoride needed to be in community water fluoridation. This was huge, and it has affected many people today. Fluoride actually strengthens teeth. It remineralizes possibly and coats teeth so that cavities are less likely to be forming on teeth. And this is really great. You can see it in toothpaste, and they've also made it default of healthy choice for everyone in the community if water has fluoride in community water as well. On the flip side, fluorosis can occur, and this is usually just in children. Fluorosis is when white spots form on baby teeth and some permanent teeth coming in as well. Fluorosis usually can go away when you see a dentist and have the proper treatments. Fluorosis also increases the chances of cavities later down the road from what the Center for Disease Control has found. And we need to be wary of that. Just in February of this year, 2019, in Sandy, there was a really big fluoride overproliferation in the water, and too many people got sick from it. That was not good. So we need to be aware of what's going on in our community, if we need to turn off the tap, buy bottled water, or in Flint, Michigan, when they had lead in their water. So these are important things to pay attention to. Finally, you have cost-effective fluoride in community water. The Center for Disease Control and Prevention found that communities small, just 5,000 people, and also communities with 200,000 people could benefit both and had cost-effective outcomes for just $4 in return investment to $27. So this was really great. All in all, fluoride in water can be helpful and it can hurt. But if we're paying attention, if we're seeing the dentist regularly, using fluoride with toothpaste, using our water from our taps, then we will be able to increase our oral health and overall health as well. And finally, I have this for everybody, and it's a handout. So just to remind you, fluoride builds foundation for healthy teeth. Thanks.